Hello students, today I welcome you again to the chemistry in everyday life chapter. So we have number of very short answer type questions and introductions. So let's do them. The first one is penicillin a broad spectrum antibiotic? Name a place in India where penicillin is manufactured. So my dear students, penicillin is not a broad spectrum antibiotic, it is a narrow spectrum antibiotic. You must know the difference between narrow spectrum and broad spectrum. Okay, when a medicine can treat more than one type of disease, like it can cure number of diseases, then that medicine comes under broad spectrum. As name suggests, that antibiotic which can treat number of diseases is known as broad spectrum, and the antibiotic which can specifically treat only one disease, that antibiotic is known as narrow spectrum antibiotic. Okay, the next one is what place. Okay, so we have place in by the name Hindustan Antibiotics. It is in Pimpri and at Indian Drug and Pharmaceutical Limited, Rishikesh. So one is in Pimpri, that is Hindustan Antibiotics, and another one is Rishikesh, Uttarakhand, that is Indian Drug and Pharmaceutical Limited. Okay, what are antibiotics? Name any two antibiotics which are specific for certain disease. Okay. Antibiotics are chemical substances produced by microorganisms like bacteria, fungi, and molds. They inhibit the growth or even destroy other harmful microorganisms responsible for causing infections like typhoid, pneumonia, and tuberculosis. Okay, so the antibiotics are chloromycetin. It is specifically used for typhoid. Streptomycin, which is specifically used for tuberculosis, TB. So these both antibiotics are narrow spectrum antibiotics. Okay, give an example of a narcotic which is used as an analgesic. A narcotic and analgesic. Okay, so morphine is the answer. Narcotic is that drug which causes sleep or sedation, and analgesic is that drug which reduces pain. I must say morphine is the most important and the strongest painkiller available on earth. Okay, morphine. So when a patient is suffering from acute and chronic cancer, stage 4, stage 3, stage 2, at that time, to relieve pain, they are being administered with morphine. Okay, even after surgery, if there is a huge pain in somebody's body, they can be prescribed morphine by the doctors. So it is the strongest painkiller available. Okay, name a substance which can be used both as an antiseptic as well as disinfectant. So that substance is phenol. Name the medicine which can act both as an analgesic as well as antipyretic. That is aspirin. Okay, that is, it can reduce pain as well as it can reduce fever. Why we add biothionyl into the toilet soap? We add biothionyl into the toilet soap because biothionyl has antiseptic properties. Okay, what is the role of biothionyl in toilet soap? That is antiseptic property. Next is phenacetin is what kind of drug? It is antipyretic. It lowers body temperature. Next one is name the chemical responsible for antiseptic properties of Dettol. Chloroxylenol and terpineol. These are two substances, chemicals, which are added into Dettol to increase their antiseptic property. Next is what is radiotherapy? Beta, radiotherapy is the treatment of disease by using radioisotope. Okay, so usually radiotherapy is done in case of cancer patients. For example, cobalt 60 is used for the treatment of malignant cell related to cancer, and P32 is used for the treatment of leukemia, that is blood cancer, and I131 is used in the treatment of thyroid. Next is state the use of Equanil and morphine as medicines. So बच्चों, Equanil is a kind of a tranquilizer. It elevates the mood. It is used in mental depression and hypertension. Whereas morphine, I already told you, analgesic as well as narcotic. It is the strongest painkiller available. It is used for inducing sleep and unconsciousness in case of severe pain due to injury. Sulfur drugs work like antibiotic, but they are not antibiotic. How we can say that? Sulfur drugs like sulfanilamide, sulfadizine, sulfaguanidine act against microorganisms like antibiotics. Okay, they act against microorganisms like antibiotics. These drugs were in common use against diseases like pneumonia, diphtheria, TB, etc. before the discovery of antibiotics. Nowadays, antibiotics like chloramphenicol, tetracycline, penicillin, etc. These are largely used in place of sulfur drugs. This is because the latest antibiotics have more powerful range as compared to sulfur drugs. Next is the statement that sulfur drugs work like antibiotic is partially valid because antibiotics are more effective. I told you the latest discovery of the antibiotic, the modern antibiotics are more effective as compared to sulfur drug, and they control the spreading of infection more speedily than sulfur drug. So dear students, this was today's lecture. Please write the questions, answers which I'm going to send you in the form of worksheet in your school notebook copy. Best of luck, stay safe, stay home and study hard.